All right, so today I want to talk to you about licensing in healthcare. And I think we've talked about this quite often, that healthcare is quite regulated and you really need to know what you're doing to work in healthcare. So I'm going to use the acronym of SAFE, SAFE, to talk about it. The first one is state. It depends on what state you're in. It is important to know the regulations that govern your state. For example, in the state of Texas, hospitals cannot be owned by MDs. It's a no-no. It's a no-no. Or a non-MD cannot own a clinic, except really you can't. Like you could do an MSO, which is a management service organization that supports the clinic, but really the medical part of it. So knowing state regulation is key. The next one is accreditation. Okay, and so if you're in a clinic or in a hospital, the Joint Commission is well known. The Joint Commission, you have DNV, you have CPHQ. There are various accrediting body that will be necessary. You've got CLIA, if you're looking at lab, just so many things to be aware of. The next one is federal. So you've dealt with state, you know your accreditation, and accreditation is based off the discipline, okay? Discipline. So even the Joint Commission has disease specific. So this is based off the discipline, the specificity. But federal focuses on the bigger picture, right? And the big picture of federal regulations often have to do with money. Healthcare is really more of a state purview, but when you start getting money-wise, the federal government wants to be involved. So being aware of licensing, say for example, even as a clinician, your MD license may be state regulated, but it has a federal tie to it. And then the last one, state accreditation, federal, and then everyone else. And everyone else is basically people who want your money. The truth is, Joint Commission, DNV, and these guys, they are agencies that support CMS. And CMS, Center for Medicare and Medicaid Services, are basically the arm of government that regulate and manage Medicare and Medicaid lives, as stated, right? So it's still about the money. So licensing in healthcare, yes, it's clinical. Yes, it has to do with, making sure that things are safe for everyone, right? But somewhere in there, the dollar bills still play a part. Thank you. See you in the next video.